Hey guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we are going to talk about pill-induced esophagitis, also known as drug-induced esophagitis. Before we go any further, I need you to understand that this video is for educational purposes only. If you have any questions or concerns, please do not hesitate to call or contact your primary care physician or physician assistant. What is drug-induced esophagitis or pill-induced esophagitis? Pill-induced esophagitis is when the medication gets stuck in the esophagus and the medication dissolves in the esophagus, causing irritation and or ulceration of the esophagus. This usually happens when the patient or the individual takes the medication but does not drink enough fluid after taking the medication, or the patient takes the medication, goes to bed right after taking the medication, and the medication sits in the esophagus, causing irritation and or ulceration. Also, when the patient is immobile, does not take enough fluid, or does not take the medication with food, if you can take the medication with food. Let's go ahead and illustrate how this happens. Usually, when the patient takes the medication, this is the esophagus right here. So this right here is the esophagus. The patient takes the medication and the medication gets stuck in the esophagus instead of moving all the way to the stomach. So this is the stomach right here. When the medication sits in the esophagus, it creates irritation or ulceration of the esophagus. And this causes symptoms which I'm going to tell you all about right now. What are some of the most common symptoms of pill-induced esophagitis or drug-induced esophagitis? The most common symptoms are Odynophagia, which is painful swallowing, dysphagia, which is trouble swallowing, chest pains or chest burning, which this makes sense because the medication sits in the esophagus and your chest is just right here, causing the symptoms of irritation, chest pain, chest burning. The patient may also complain that the food or the tablet seems to get stuck in the esophagus. Those are some of the most common symptoms. What are some of the most common medications that causes pill-induced esophagitis? For example, some antibiotics such as Doxycycline, tetracycline, clindamycin, some medications, for example, NSAIDs, Aleve, ibuprofen, Biciguti powders, aspirin. This is just to name a few. So now you suspect the patient has pill-induced esophagitis or esophagitis. And what are you going to do? How are you going to diagnose it? The best thing that you can do is to always take a good history, listen to the patient, hear what they have been doing, and if you highly suspect drug-induced esophagitis, then refer the patient to a gastroenterologist, and the patient will need an upper endoscopy, a diagnostic upper endoscopy, which is a scope that goes down the throat all the way to the stomach. It takes a look at the stomach, it takes a look at the duodenum, and takes random biopsies to see what is going on. Once you have the diagnosis, how are you going to treat the pill-induced esophagitis or esophagitis in this case? Number one, you have to avoid the offending agent. You have to make sure you stop the medication that is causing the issue. Number two, you're going to need a medication to treat the issue, such as an acid-reducing medication, for example, omeprazole, pantoprazole, Pepcid, just to mention a few. Also, a liquid medication such as Carafate, and I'm going to give you a hint. If your doctor gives you Carafate in the tablet form, make sure to always dissolve the Carafate in at least 4 ounces of water and then take the medication. Try not to take it in the solid form. Lastly, how are you going to prevent having pill-induced esophagitis or drug-induced esophagitis? The first thing that I highly recommend is that every time you take your medication, make sure you take the medication with enough fluid. For example, I recommend to take a little bit of fluid before taking the medication, take the medication, and then followed with at least 8 ounces of water, which is 240 mLs of water. Also, avoid taking the medications right before going to bed, because some individuals take the medication, they take a little bit of fluid, go straight to bed, and the medication stays sitting in your esophagus, causing the esophagitis, pill-induced esophagitis. Guys, if you found this video helpful, click like, subscribe, so I can bring you more videos like this. And if you want to watch more videos, please click on this one right here, and I'll see you in the next one. Bye.